Hi, everyone. My name is Jillian Parker, and today I'm joined by Dr. Tara Gellasch, who is an OBGYN and the Chief Medical Officer at United Memorial Medical Center, to continue talking about the COVID-19 vaccine. A lot of questions around the vaccine, and today's conversation is really geared towards pregnancy and breastfeeding. Dr. Gellasch, thanks for joining us.
Thank you for having me.
So first question I have for you is whether or not it is safe for pregnant or breastfeeding mothers to get the COVID-19 vaccine. What do we know about that so far?
So we do absolutely believe that it is safe, and both the American College of Obstetrics and Gynecology and the Society for Maternal and Fetal Medicine have both put out statements stating that pregnant women who are eligible for the vaccine should absolutely receive the vaccine.
Are there any side effects that someone might experience that could be passed on to their baby or passed on through breastfeeding?
So no, there does not appear to be any effect on the breast milk that could somehow cause side effects to the baby. So absolutely, women who are breastfeeding are also encouraged to get the vaccine when they are eligible for the vaccine and when it's available to them. In terms of, but in terms of side effects that women may experience themselves, it would be similar to the side effects that any adult might experience when they're receiving the vaccine. So they may have a low-grade temperature or some muscle aches, and those can be easily treated with acetaminophen or Tylenol.
Is there anything different that couples who are considering becoming pregnant should be thinking about or should be aware of? Are there any additional risks when you're in that process of it?
No, and in fact, we would actually encourage women who are planning to start their family to actually get the vaccine as soon as it's made available to them. That would certainly protect them against getting the infection, during that future pregnancy.
That was one of the next things I was going to say is there might be people out there wondering, am I and my baby safer by not getting the vaccine if it could put me at risk? But then you would be putting yourself at risk of obviously contracting COVID-19.
Correct.
So, any concerns about pregnant women or people considering to become pregnant, choosing not to get it?
Well, certainly we want to support any woman's decision on what they ultimately choose, whether it's to get the vaccine or to not get the vaccine. But certainly we do know that pregnant women who do contract COVID are at a higher risk of developing a severe form of the illness and are at a higher risk of hospitalization or ICU admission or even requiring ventilation. And so certainly, pregnant women are a vulnerable population, particularly pregnant women who may have other underlying health conditions, such as diabetes or obesity. So absolutely, we would encourage women to get that vaccine as soon as it's available to them if they're considering becoming pregnant.
And I know that there's some false information being spread around on the website. We've seen it on a couple comments on our social media pages about infertility and whether or not getting the COVID-19 vaccine could lead to infertility. Can you clear up any rumors or false information around that?
No, that's a great question. So there is absolutely no evidence that the vaccine results in infertility. In fact, this vaccine does not enter the nuclei of cells. It does not alter our genetic material. And so there is absolutely no reason to believe that it has any effect on fertility, either in the short term or long term.
And is there anything else that you wanted to touch on that you think is important to get across?
Well, I think certainly, we see, we have a lot of women working in healthcare. And I think certainly I would encourage, women who are on the front lines of this pandemic to get the vaccine when it becomes available to them. I believe that it's going to make them safer during their pregnancy, whether they're currently pregnant or a future pregnancy down the road.
All right, some good tips. And I know a lot of questions that people have been thinking about. Dr. Gellasch, thanks so much for answering some of those for us today.
Thank you. I appreciate it.